Fertilization is the epic story of a single sperm facing incredible odds to unite with an egg and form a new human life. It is the story of all of us. During sexual intercourse, about 300 million sperm enter the vagina. Soon afterward, millions of them will either flow out of the vagina or die in its acidic environment. However, many survive because of the protective elements provided in the fluid surrounding them. Next, the sperm must pass through the cervix, an opening into the uterus. Usually, it remains tightly closed, but here the cervix is open for a few days while the woman ovulates. The sperm swim through the cervical mucus, which is thinned to a more watery consistency for easier passage. Once inside the cervix, the sperm continues swimming toward the uterus, though millions will die trying to make it through the mucus. Some sperm remain behind, caught in the folds of the cervix, but they may later continue the journey as a backup to the first group. Inside the uterus, muscular uterine contractions assist the sperm on their journey toward the egg. However, resident cells from the woman's immune system, mistaking the sperm for foreign invaders, destroy thousands more. Next, half the sperm head for the empty fallopian tube, while the other half swim toward the tube containing the unfertilized egg. Now, only a few thousand remain. Inside the fallopian tube, tiny cilia push the egg toward the uterus. To continue, the sperm must surge against this motion to reach the egg. Some sperm get trapped in the cilia and die. During this part of the journey, chemicals in the reproductive tract cause the membranes covering the heads of the sperm to change. As a result, the sperm become hyperactive, swimming harder and faster toward their destination. At long last, the sperm reach the egg. Only a few dozen of the original 300 million sperm remain. The egg is covered with a layer of cells called the corona radiata. The sperm must push through this layer to reach the outer layer of the egg, the zona pellucida. When sperm reach the zona pellucida, they attach to specialized sperm receptors on the surface, which triggers their acrosomes to release digestive enzymes, enabling the sperm to burrow into the layer. Inside the zona pellucida is a narrow, fluid-filled space just outside the egg cell membrane. The first sperm to make contact will fertilize the egg. After a perilous journey and against incredible odds, a single sperm attaches to the egg cell membrane. Within a few minutes, their outer membranes fuse and the egg pulls the sperm inside. This event causes changes in the egg membrane that prevent other sperm from attaching to it. Next, the egg releases chemicals that push other sperm away from the egg and create an impenetrable fertilization membrane. As the reaction spreads outward, the zona pellucida hardens, trapping any sperm unlucky enough to be caught inside. Outside the egg, sperm are no longer able to attach to the zona pellucida. Meanwhile, inside the egg, the tightly packed male genetic material spreads out. A new membrane forms around the genetic material, creating the male pronucleus. Inside, the genetic material reforms into 23 chromosomes. The female genetic material, awakened by the fusion of the sperm with the egg, finishes dividing, resulting in the female pronucleus, which also contains 23 chromosomes. As the male and female pronuclei form, spiderweb-like threads, called microtubules, pull them toward each other. The two sets of chromosomes join together, completing the process of fertilization. At this moment, a unique genetic code arises, instantly determining gender, hair color, eye color, and hundreds of other characteristics. This new single cell, the zygote, is the beginning of a new human being. And now the cilia in the fallopian tube gently sweep the zygote toward the uterus, where he or she will implant in the rich uterine lining, growing and maturing for the next 9 months until ready for birth.
Fertilization, also referred to as conception, impregnation, or fecundation, is the union of an ovum and a spermatozoon. This usually occurs in the outer third of a fallopian tube, the ampular portion. Usually, only one ovum reaches maturity each month. Once it is released, fertilization must occur fairly quickly because an ovum is capable of fertilization for only 24 hours, or 48 hours at the most. After that time, it atrophies and becomes non-functional. Because the functional life of a spermatozoon is about 48 hours, possibly as long as 72 hours, the total critical time span during which sexual relations must occur for fertilization to be successful is about 72 hours, 48 hours before ovulation plus 24 hours afterwards. As the ovum is extruded from the Graafian follicle of an ovary with ovulation, it is surrounded by a ring of mucopolysaccharide fluid known as zona pellucida and a circle of cells known as corona radiata. The ovum and these surrounding cells, which increase the bulk of the ovum and serve as protective buffers against injury, are propelled into a nearby fallopian tube by currents initiated by the fimbriae, the fine hair-like structures that line the openings of the fallopian tubes. A combination of peristaltic action of the tube and movements of the tube cilia help propel the ovum along the length of the tube. Normally, an ejaculation of semen averages 2.5 milliliter of fluid containing 50 to 200 million spermatozoa per milliliter, or an average of 400 million sperm per ejaculation. At the time of ovulation, there is a reduction in the viscosity or thickness of the cervical mucus, which makes it easier for spermatozoa to penetrate it. Sperm transport is so efficient close to ovulation, the spermatozoa deposited in the vagina during intercourse generally reach the cervix within 80 seconds and the outer end of a fallopian tube within 5 minutes after the deposition. This is one reason why douching is not an effective contraceptive measure. Spermatozoa move by means of their flagella, or tails, and uterine contraction through the cervix and the body of the uterus and into the fallopian tubes toward the waiting ovum. The mechanism whereby spermatozoa are drawn toward an ovum is probably a species-specific reaction similar to an antibody-antigen reaction. Capacitation is a final process that sperm must undergo to be ready for fertilization. This process, which happens as the sperm move toward the ovum, consists of changes in the plasma membrane of the sperm head, which reveal the sperm binding receptor sites. All of the spermatozoa that achieve capacitation reach the ovum and cluster around the protective layer of corona cells. Hyaluronidase, a proteolytic enzyme, is apparently released by the spermatozoa and acts to dissolve the layer of cells protecting the ovum. It is believed that one reason an ejaculation contains large numbers of sperm is to provide enough enzymes to dissolve the corona cells. Under ordinary circumstances, only one spermatozoon is able to penetrate the cell membranes of the ovum. Once it penetrates the cell membrane changes composition to become impervious to other spermatozoa. An exception to this is the formation of hydatidiform mole known as age mole, in which multiple sperm cells enter. This leads to abnormal growth. Immediately after penetration of the ovum, the chromosomal material of the ovum and the spermatozoon fuse. The resulting structure is called a zygote. Because the spermatozoon and ovum each carry 23 chromosomes, 22 autosomes, and one sex chromosome, the fertilized ovum has 46 chromosomes. If an X carrying spermatozoon enter the ovum, the resulting child will have two X chromosomes and will be female. If If a Y-carrying spermatozoon fertilizes the ovum, the resulting child will have an X and a Y chromosome and will be male. Fertilization is never a certain occurrence because it depends on at least three separate factors. One, equal maturation of both sperm and ovum. Two, the ability of the sperm to reach the ovum. And three, the ability of the sperm to penetrate the zona pellucida and the cell membranes and achieve fertilization. From the fertilized ovum, known as zygote, the future child and also the accessory structures needed for support during intrauterine life, such as placenta, fetal membranes, amniotic fluid, umbilical cord, are all formed. There are three stages of prenatal development: the germinal period, the embryonic period, and the fetal period. The germinal period is the first 2 weeks after conception. This includes the creation of the zygote, continued cell division, and the attachment of the zygote to the uterine wall. Once fertilization is complete, the zygote migrates over the next 3 to 4 days toward the body of the uterus, aided by the currents initiated by the muscular contractions of the fallopian tubes. During this time, mitotic cell division or cleavage begins. The first cleavage occurs at about 24 hours. Cleavage division continues to occur at a rate of about every 22 hours. By the time the zygote reaches the body of the uterus, it consists of 16 to 50 cells. At this stage, because of its bumpy outward appearance, it is termed a morula, from the Latin word morus, meaning mulberry. The morula continues to multiply as it floats freely in the uterine cavity for 3 or 4 more days. Large cells tend to collect at the periphery of the ball, leaving a fluid space surrounding an inner cell mass. At this stage, the structure is termed a blastocyst. It is this structure that attaches to the uterine endometrium. The cells in the outer ring are known as trophoblast cells. They are the part of the structure that will later form the placenta and membranes. The inner cell mass, known as embryoblast cells, is the portion of the structure that will form the embryo. Implantation or contact between the growing structure and the uterine endometrium occurs approximately 8 to 10 days after fertilization. After the third or fourth day of free floating, or about 8 days since ovulation, the last residues of the corona and zona pellucida are shed by the growing structure. The blastocyst brushes against the rich uterine endometrium, a process termed opposition. It attaches to the surface of the endometrium, known as adhesion, and settles down into its soft folds, known as invasion. The blastocyst is able to invade the endometrium because, as the trophoblast cells on the outside of the structure touch the endometrium, they produce proteolytic enzymes that dissolve the tissue they touch. This action allows the blastocyst to burrow deeply in the endometrium and receive some basic nourishment of glycogen and mucoprotein from the endometrial glands. As invasion continues, the structure establishes an effective communication network with the blood system of the endometrium. The touching of implantation point is usually high in the uterus on the posterior surface. Implantation is an important step in pregnancy because as many as 50% of zygotes never achieve it. In this instance, the pregnancy ends as early as 8 to 10 days after conception, often before the woman is even aware it had begun. Occasionally, a small amount of vaginal spotting appears with implantation because capillaries are ruptured by the implanting trophoblast cells. A woman who normally has a particularly scant menstrual flow may mistake implantation bleeding for her menstrual period. If this happens, the predicted date of birth of her baby will be calculated 4 weeks late. Once implanted, the zygote is called as embryo. The second stage of prenatal development is the embryonic period, which is 2 to 8 weeks after conception. In this stage, the name of the mast cells, zygote, become embryo. The following developments take place. Cell differentiation intensifies, life support system for the embryo develop, and organ appear. As the zygote gets attached to the wall of the uterus, two layers of cells are formed. The embryo's endoderm, the inner layer of cells, develops into the digestive and respiratory systems. The outer layer of the cells is divided into two parts, the ectoderm and the mesoderm. The ectoderm is the outermost layer, which becomes the nervous system, sensory receptors such as eyes, ears, nose, and the skin parts, nails, and hairs. The mesoderm is the middle layer, which becomes the circulatory system, skeletal system, muscular system, excretory, and reproductive systems. This process of organ formation during the first 2 months of prenatal development is called organogenesis. As the three layer of the embryo form, the support systems for the embryo develop rapidly. These life support systems are the placenta, the umbilical cord, and the amnion. The placenta is a life support system that consists of a disc-shaped group of tissues in which small blood vessels from the mother and the offspring intertwine but do not join. The umbilical cord contains two arteries and one vein that connects the baby to the placenta. The amnion is a bag of an envelope that conceals a clear fluid in which the developing embryo floats. All these embryo life support systems develop from the fertilized egg and not from the mother's body. The third stage of prenatal development is the fetal period, which is 2 months to 7 months after conception. Growth and development continue dramatically during this period. 3 months after conception, fetus is about 3 inches long and weighs about 1 ounce. Fetus has become active, moves its arms and legs, opens and closes its mouth, and moves its head. The face, forehead, eyelids, nose, chin can now be distinguished, and also the upper arms, hands, and lower limbs. The genitals can now be identified as male or female. 4 months after conception, fetus is about 6 inches long and weighs 4 to 7 ounces. Growth spurts occur in the body's lower parts. Prenatal reflexes are stronger. Mother feels arm and leg movements for the first time. 5 months after conception, fetus is about 12 inches long, weighs close to a pound. Structure of the skin, such as fingernails and toenails, have formed. Fetus is more active. 6 months after conception, fetus is about 14 inches long and weighs 1.5 pounds. Eyes and eyelids are completely formed. Fine layer of hair covers the head. Grasping reflex is present and irregular movements occur. 7 months after conception, fetus is about 16 inches long and weighs 3 pounds. 8 and 9 months after conception, fetus grows longer and gains substantial weight about 4 months. Teratology is the field that investigates the causes of congenital birth defects. A teratogen is that which causes birth defects. It comes from the Greek word tera, which means monster. There are 5 clusters of hazards to prenatal development, namely prescription and non-prescription drugs, psychoactive drugs, environmental hazards, other maternal factors, and lastly, paternal factors. Prescription and non-prescription drugs. These include prescription as well as non-prescription drugs. Antibiotic is an example of a prescription drug that can be harmful. Examples of harmful non-prescription drugs are diet pills, aspirin, and coffee. Remember the thalidomide tragedy in 1961? Many pregnant women took in thalidomide, a tranquilizer, to alleviate their morning sickness that gave rise to several deformed babies.
Afternoon. I have several announcements. Every doctor, every hospital, every nurse have been notified. Every woman in this country must be aware that it's most important that they check their medicine cabinet and that they do not take this drug.
In the early 1960s, no drug struck more fear into the hearts of pregnant women
One of the most horrifying episodes in medical history.
than thalidomide. It changed our relationship with the drugs we use
One reason U.S. drug laws are so strict, thalidomide.
and became an example of what many saw as corporate greed at its worst.
British thalidomide children so far have not received any compensation from the rich company that made the drug which crippled them so brutally.
But this dark chapter is only part of thalidomide's enigmatic story, one that continues to reverberate today.
I had used up every other alternative when I took thalidomide.
In 1960, a new wonder drug was slated to arrive on American shores, a sedative that was said to also treat a range of other ills.
A hypnotic, as the doctors call it, that was the answer to a prayer. Its generic name was thalidomide.
The hallmark defining quality of thalidomide was its safety. So safe that in Germany there was no prescription needed.
The German company that developed thalidomide, Chemie Grunenthal, claimed that even pregnant women could take it.
The drug company had handed out samples of this drug all over the place, starting with employees of its own company. On Christmas Day in 1956, a baby girl was born in Germany without ears. And she was the daughter of an employee of the drug company Grunenthal.
No immediate connection was made to thalidomide, which soon sold nearly as well as aspirin in some European countries.
We received it in quantities like 1,000 pills. There was tremendous pressure all over the world to get this wonderful new drug on the market.
They had 2 million tablets ready to go the moment the FDA approved the drug, which was almost a foregone conclusion, until one doctor came along and began working at the FDA.
It just so happened that my first application was for the drug thalidomide. I got this because I was new and they thought I should have an easy one to start on.
But Dr. Kelsey was uneasy with what she saw as the lack of rigorous scientific studies and the slipshod presentation of safety data provided by Grunenthal and William S. Merrill, the U.S. distributor of the drug.
The best thing that could be said about thalidomide at the time was simply that you could not kill a rat, no matter how much thalidomide the rat ate.
With thalidomide being prescribed for morning sickness in other countries, Kelsey became particularly concerned with what effect it might have on a developing fetus. In June of 1961, an article appeared promoting its safety during late pregnancy.
It was allegedly written by a Dr. Ray Nolson, but in fact, the article was written by the medical director of the drug company.
About 6 months later, long-ignored evidence became public in Germany, linking thalidomide to a rash of birth defects. Although hundreds of thousands of pre-market samples had been provided to American doctors, Dr. Kelsey's stubborn delay of the drug's approval for more than a year had prevented a similar scale of tragedy from unfolding in the United States.
Dr. Kelsey was absolutely a unique hero in American history.
But thalidomide's reach continued to be felt across the rest of the world, including in Trinidad and Tobago, where Giselle Cole was born.
When I came along, I'm a firstborn, and they were a young married couple. I mean, I was never unloved or not wanted or anything like that. But I would be foolish to think that it was easy for them. My disability is, the official term is phocomelia, coming from the Greek meaning shorter arms or flipper-like. I think people always expect that I would have been angry. And I'm certainly not angry and never have been.
Long discussed but seldom implemented, major regulatory reforms were finally forced on the pharmaceutical industry following the thalidomide scandal.
For some time, President Kennedy has tried to get Congress to approve new controls, but without much success. Now, with the thalidomide scare, most of the opposition has melted.
Largely the same FDA guidelines that we live under today were created in the immediate wake.
These regulations were too late for thalidomide's thousands of surviving victims across the world, who soon became the story.
Philippa Bradbourne is one example. Her mother rejected her.
10-year-old Carl Davies leads a relatively normal life for a boy without arms.
Another young mother, her husband, her sister, and her doctor are charged with the mercy killing of her deformed infant.
I'm one of the lucky ones in that my parents were adamant that I was their daughter, and their daughter first before anything else, and it was treated as such. Many were put in homes because they just didn't know what to do. Some families battled with doctors to have amputation of fingers and toes and whatnot to accommodate these prosthetics. Many families were broken irrevocably.
Instead of quickly settling, the drug companies dug in, with Grunenthal originally arguing that the children's deformities were caused by everything from nuclear fallout to botched home abortions, anything but thalidomide.
It was a very long and difficult process.
Most cases were eventually settled, but litigation continues, with some survivors saying the original settlements cannot cover the cost of their specialized care. Grunenthal didn't apologize to its victims until 2012, 50 years after the tragedy unfolded.
They issued a statement saying that it has taken them the 50 years to come forward to say anything because they were shocked. They don't have a right to be shocked. The shock doesn't belong to them.
Despite all that thalidomide's victims endured over the decades, they could long take solace in one simple fact.
Thalidomide is now banned everywhere.
The now banned thalidomide.
The drug was banned in 1962.
And I would have liked to have seen it never used again.
There's a tremendous amount of luck in science. It's almost like an Easter egg hunt.
In 1992, while conducting research into macular degeneration, ophthalmologist Robert D'Amato began his own hunt. This one to find a pill that might restrict blood vessel growth.
I started searching for drugs that cause some sort of damage to a fetus, a birth defect, and at the top of this list was thalidomide.
Although thalidomide had been banned around the world, unbeknownst to many, the drug was later made available for limited humanitarian use, thanks to a chance discovery.
In 1964, a doctor in Jerusalem was taking care of a patient who had such severe leprosy that he was in pain and couldn't sleep. He decided to treat the patient with thalidomide to see if it would help with the sleep, and began to notice that there was also improvements generally in the leprosy.
After much trial and error, Dr. D'Amato finally had a similar breakthrough when he demonstrated that thalidomide could starve blood flow to cells, a discovery that held the potential for treating cancerous tumors.
The people that really understood the results were excited because we had a tool that we didn't have before. But the knee-jerk reaction was, this is a dangerous drug, no one would ever want to use it. There was thousands of victims that still remain. There had been a promise that thalidomide would never be developed again.
We had to make a decision what position we were going to take. Many would have thought and expected that we would have been screaming, no, 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 no.
But, following a surge of reports about promising studies, that's not what happened.
We are nervous. We are, of course, frightened and dismayed. But we realize that this is not a perfect world.
Thalidomide is back.
The Food and Drug Administration says thalidomide will be the most restricted drug ever distributed.
Female patients taking the drug will even have to submit to pregnancy tests.
Since then, thalidomide has gone on to combat a surprising variety of diseases, from tuberculosis and Crohn's disease to multiple sclerosis and symptoms of HIV and AIDS. And D'Amato's hunch about the drug's effect on cancerous tumors paid off in a groundbreaking treatment for certain types of the disease.
Thalidomide and its derivatives have become the primary treatment for multiple myeloma.
It's a very fine line that I walk, and many of us walk, when we think about thalidomide in today's world. Clearly, you can see what it has done to the thousands of us who are still on this earth. But if it provides some kind of assistance, help, relief of suffering, then I cannot, in good conscience, be opposed.
Brenner, who saw thalidomide's curative powers firsthand after being prescribed it for a deadly skin disease, says that the drug's circuitous history tells us a great deal about the accidental nature of drug discovery.
It's kind of surprising, I think, to most people to learn that drugs are, in fact, developed and then become, as they're called, a drug in search of a disease.
When you have a drug that has a powerful activity, whether it's negative or not, that powerful activity could be used for something good if you could figure out what that was.
But for all its benefits, the scientific rehabilitation of thalidomide has come with a heavy cost.
We were told this could never happen again.
In Brazil, where the drug is used extensively to treat leprosy, researchers report that thalidomide children continue to be born, as many as 100 since 2005 by one recent estimate.
50 years down the road, I would like to think that there's no such thing as thalidomide, that we have created something, that we have developed something that would allow us to bury thalidomide. Literally. Destroy it, get rid of it, so that there are no further discussions other than a note in history.
The second one is psychoactive drugs. This include nicotine, caffeine, and illegal drugs such as marijuana, cocaine, and heroin. Cocaine exposure during prenatal development is associated with reduced birth weight, length, and head circumference, impaired motor development, impaired information processing, and poor attention skills. Researchers found that pregnant women who drank more caffeinated coffee were more likely to have preterm deliveries and newborns with lower birth weight compared to their counterparts who did not drink caffeinated drinks. Heavy drinking by pregnant women results to the so-called fetal alcohol syndrome, or FAS, which is a cluster of abnormalities that appear in the children of mothers who drink alcohol heavily during pregnancy. These abnormalities include facial deformities and defective limbs, face, and heart. Most of these children are below average in intelligence, and some are mentally retarded. Fetal and neonatal deaths are higher among smoking mothers. These are also higher incidences of preterm birth and lower birth weights among children with smoking mothers. On the average, maternal heroin addicts deliver smaller than average size babies with more incidence of toxemia, premature separation of placenta, retained placenta, profuse bleeding after birth, and breech deliveries. The third one is environmental hazards. These include radiation in job sites and X-rays, environmental pollutants, toxic wastes, and prolonged exposure to heat in saunas and bathtubs. Research found that chromosomal abnormalities are higher among the offsprings of father exposed to high levels of radiation in their occupations. Radiation from X-ray also can affect the developing embryo and fetus, with the most dangerous time being the first several weeks after conception, when women do not yet know that they are pregnant. Research has found that toxic wastes such as carbon monoxide, mercury, and lead cause defects in animals exposed to high doses. For instance, early exposure to lead affects children's mental development. Remember the actions of the USA for the children's toys with high lead content manufactured in China? Prolonged exposure of pregnant mothers to saunas or hot tubs raise the mother's body temperature, creating fever that endangers the fetus. The high temperature due to fever may interfere with cell division and may cause birth defects or even fetal death if the fever occurs repeatedly for prolonged periods of time. The fourth one is other maternal factors. Other maternal factors such as rubella or German measles, syphilis, genital herpes, AIDS, nutrition, high anxiety and stress, and age, which is too early or too late or beyond 30. A rubella or German measles in 1964 to 1965 resulted in 30,000 prenatal and neonatal newborn deaths, and more than 20,000 affected infants were born with malformations including mental retardation, blindness, deafness, and heart problems. Syphilis damages organs which after they have formed. These damages include eye lesions, which can cause blindness, and skin lesions. When syphilis is present at birth, other problems involving the central nervous system and gastrointestinal tract can develop. About one-third of babies delivered through a herpes-infected birth canal die. Another one-fourth becomes brain damage. A mother can infect her child in three ways. The first one is during gestation across the placenta. The second is during delivery through contact with maternal blood or fluids. And the third one is postpartum through breastfeeding. Studies show that increased stress during pregnancy leads to premature birth and reduced birth weight. Other studies have shown that increased stress during pregnancy is related to ADHD, even schizophrenia later in life. Admittedly, more research on the effects of emotional states and stress needs to be conducted for more conclusive findings. It is recognized that maternal malnutrition during pregnancy may result to inadequate growth in the fetus. If a fetus does not receive enough nourishment, the rate of cell division is seriously hampered. An extremely deprived fetus may have 20% fewer brain cells than normal. If an infant has been malnourished both in utero and infancy, the brain may be as much as 60% smaller than that of the normal child. Folic acid is necessary for pregnant mothers. Folic acid can reduce the risk of having a baby with a serious birth defects of the brain and spinal cord called the neural tube. A baby with spina bifida, the most common neural tube defect, is born with a spine that is not closed. The exposed nerve are damaged, leaving the child with varying degrees of paralysis and sometimes mental retardation. As mother age increases, the risk for numerical chromosomal abnormalities increases as well. The mortality rate of infants born to adolescent mother is double than that of infants born to mothers in their 20s. A baby with Down syndrome rarely is born to mothers under age 30, but the risk increases after the mother reaches 30. By age 40, the probability is slightly over 1 in 100, and by age 50, it is about 1 in 10. The risk is also higher before age 18. The last one is the paternal factors. Father's exposure to lead, radiation, certain pesticides, and petrochemicals may cause abnormalities in sperm that lead to miscarriage or diseases such as childhood cancer. As in the case of older mothers, older fathers also may place their offsprings at risk for certain defects.